Hello and welcome to Neuroshambles, the podcast that aims to shine a light into some of the murkier corners of what it's like to parent neurodivergent kids. I'm Mark Allen, and every episode I'm going to be swapping stories with my guests about some of the frankly ludicrous nonsense we have to deal with on a daily basis. So, if you're anything like me and you're feeling frazzled, overwhelmed and pretty much an outcast from polite society, join me. Hello and welcome to episode 50 of Neuroshambles. Sweet crikey, who'd have thought that I'd have made it to half a century of episodes when I first hatched the idea about 2.5 years ago. It's been an absolute pleasure to have been able to pick you guys up along the way and share stories from my frankly bewildering household. I genuinely appreciate every single one of you magnificent people. To celebrate the big 5-0, it's only fitting that my guest is a long-time Neuroshambles listener as we discuss an intriguing topic of the week, as well as Neurodiversity Champions, tiny epic wins, and, of course, some what the flip moments. So, let us dispense of the preamble and get cracking.
Meet the guest.
So this week's guest is a long-time listener of Neuroshambles who wrote in via email to suggest a topic of the week. As well as being a parent of a neurodivergent child, she's also a registered GP, so she has a very interesting perspective that I'm really keen to hear more of. I am delighted to be able to welcome to the podcast, it's Lucy Pocock. How are you doing, Lucy?
Hi, I'm very well, thanks. Thanks for having me.
More than welcome. So, as I do with all of my guests, I want to find out a little bit more about your setup there. So, what neurodivergencies are at play in your household?
Well, I think we have two parents who are in denial about being neurotypical, because we probably can't both be, can we? We have a son who is 10. And he is collecting the full set of diagnoses. So
like a Panini sticker album. He's like
exactly that. Yeah, it is full. So he's autistic with a PDA profile.
Diagnosed autistic.
Yes, diagnosed autistic. Obviously not diagnosed PDA because that's rare as hen's teeth, isn't it?
They sort of put it as a little footnote.
Demand avoidant profile. I think.
They did that with India as well.
PDA as fuck, I think, is the technical term for it. And also ADHD, dyslexic, dyscalculic.
Okay, so yes, he's really doing well with the collection at the moment.
Yeah, so I think, between me and my husband, we can't possibly be neurotypical, both of us, can we? But
yeah, fine. Well, yeah, thanks for introducing me to your setup. There's a lot to cover in this one, so let's get started.
What's the topic of the week?
So the topic of the week this week is about the healthcare system in the UK. So it's one that many neuroshamblers have experienced in one way or another. Now, I will caveat this by saying that we're only going to be covering the healthcare system in the United Kingdom, as that's the only one that me and my guest have any lived experience of. So apologies to any of the 19.1% of listeners that don't come from either England, Scotland, Wales or Northern Ireland. But although it doesn't directly impact you, I am hoping it'll give you an interesting glimpse into the current state of play in the UK's National Health Service. And there's probably going to be some things that resonate with you wherever you are. I think we should start by saying that there are a couple of different pathways to referring your child for an autism or ADHD diagnosis. A couple of main ones. There are some others, but one route is via your child's school. So that's where a teacher and a SENCO, which, if you don't know, is a special educational needs coordinator, might observe behaviour in your child that is consistent with neurodivergent traits, and then they might discuss it with the parents, put together some evidence and make a referral to the local NHS neurodevelopmental service. At that point, your child is fed into the system and they're going to progress very slowly, usually, through the many different cogs of the rickety diagnosis machine, which can be anything from 12 months to 5 years. So for the sake of transparency, all 3 of my kids were referred via that route. The other main route is where parents or carers self-refer their child to a GP, which is obviously where Lucy comes in, because as a GP, she's kind of seen from that side of things. And as I don't really know about that process, I was wondering if you could talk me through it and, let other neuroshamblers who haven't been through this pathway know how that works?
I guess the first thing to say is that often it's not the best place to start. So the GP,
Okay.
unless the GP knows your child really well, which is
Mm-hmm.
unusual, to be honest, for us to know kids very well, because they often only come to us when they've got coughs and colds and things like that. So unless you know a GP very well, actually we can be very little use to this process because we don't have the evidence that's needed to
Right.
write
Okay.
a referral. So you'll often, if you do end up going to see your GP, you would probably be signposted back to school, because really in most
because
areas
they see them in their everyday
exactly,
life and they can spot them, and they also know what to expect, because as a parent of a child, you don't know if
no, of
this
course.
behavior is typical of children or not.
No, and especially in our case, we've only got one child, so if you've got no other kids to compare them to as well, that can be
Yes.
tricky. So I would say don't start with a GP. So have a chat with school, have a chat with Senko and the teacher. If you're not getting any joy that way, you can come and see the GP. But we're going to need evidence from school, because all of the assessments, diagnoses requires that you show difficulties in two different environments. So normally home and school. So we wouldn't be able to make a referral without evidence from school probably anyway.
Yeah, I guess that's where people do come to you sometimes, is when they go to the school and the school don't see enough evidence, or they just don't really believe you, then they will go to you, and then they're in that situation where you're like, well, you're gonna need to find evidence from a school. How do you navigate that?
Very
how do
difficult.
they navigate that?
And I think keeping diaries and things, because often difficulties in school, I know this now and I didn't know this before my son was diagnosed and presented with problems, but difficulties in school don't always present in school, do they? Difficulties in school often present at the end of the school day at home,
which is where masking comes in. And,
exactly. My son was a huge masker. We had no idea really until really until he was at like year 3 that there was an issue at school. And school also didn't think there was a problem. They definitely wouldn't have supported us with a diagnosis. So I think it is really tricky. But so I think keeping diaries yourself at home, collecting evidence yourself is really important.
Tam and I did a huge amount of that, and it was incredibly valuable because firstly, just to kind of build up an image of their individual profiles, because they have some issues with some things and don't have other issues with other things. So it's useful to sort of build that up. And also, the more logs that you build up and the more evidence you have, the more you can sort of present specific evidence for different authorities, because it's not just the GP that's going to need it. It's it's the LA, it is all the other authorities that are going to eventually
for DLA or whatever else you want to do with it, for sure.
It's definitely worth doing, and it is, as I've said on Neuroshambles before, it's quite heartbreaking to be logging all of that information, because you're capturing your child at the most vulnerable.
This whole process is about deficiency, isn't it? None of it's about
exactly
strengths, unfortunately.
But we're trying to get them the help they need. And so if they did log that information and the school wasn't able to sort of corroborate that, would that be enough evidence for you to be able to refer?
I mean, I think most of us would refer with that information. Whether or not the referral was accepted at the other end is another.
Right. Okay. So when we talk about a referral, you have the initial kind of contact with them if they haven't gone the school route, and you would make your own assessment of that. You would, look at logs or, kind of anecdotal evidence, and presumably to either tell them to get more evidence from the school, or if they can't do that, then just sort of cross your fingers and hope that what you've put together is enough. That then gets passed on where?
So wherever the service is, so we would send that to it. And that, unfortunately, that is different. That looks different in different areas of the country. So where I live, community paediatrics diagnose ADHD and CAMHS diagnose autism. Or is it the other way around? I can't even remember. It might be the other way around. But it's not a single pathway. So we decide where that referral was going. And we would submit that referral. And at the other end, somebody is triaging those referrals. So some professional at the other end is looking at and sometimes they get bounced back. So sometimes they get rejected.
Okay, so if it gets rejected, that comes back to you. You then know that referral hasn't been accepted. Is it on you to then tell the parents that
So usually good practice would be that the service would write to the parent as well as me.
as we know, good practice is not always the way that things work,
No.
is it?
No. And then it's between, us and the parents to try and figure out, can we get some more evidence? It might be that we haven't put a convincing case. So is there evidence that we didn't include, that we could include?
Right. Okay. So, because at this point, I'm guessing, as a parent of a neurodivergent child, you are very well read on neurodiversity, so you know what you're looking for. At this point, you probably get a very good sense of whether this child is neurodivergent or not.
I can spot them a flipping mile off now.
It's just a gift that we have, right?
Once you
know,
see it, you can't unsee it. And, parents and children.
I was thinking you could just
do
a
long.
sweep of the waiting room. Just walk around and go, you.
Exactly. No further assessment required.
So obviously you're then like, right, well, you're trying to help the parents get this through, because diagnosis is important to them, I think, just to know what's going on. You must be quite personally invested in that and fighting for them, just because you know from the other side of having to do it yourself that it's really hard.
My practice has radically changed in the last few years.
Since your own son's diagnosis?
So GPs get very little training on / no training on neurodivergent. So in my, I was at medical school 20 years ago. Nothing. Not I don't remember a single session on neurodivergence.
Wow.
And I doubt that's changed hugely now, even for the current students going through medical school. So I think, we're not trained to spot it. And I had very sort of old-fashioned views about what an autistic person looked like.
Yeah, of course.
I was the sort of
Rain Man or Forrest Gump, they're your two choices,
totally.
Right?
Which is, worrying, isn't it, really, for a GP that is the case? But that was the case, and that is the case for many of my colleagues, unfortunately.
Right. Okay.
So I'm now a huge advocate. I hope I tried to be an advocate, because I was very lucky that at our GP surgery, when my son crashed out of school with burnout, her daughter had experienced the same thing.
Right. Okay.
And I just lucked out that I spoke to her one day, and she said, "Look, my daughter went through burnout. This is what it looked like." And she wrote letters to the school for me. She signed me off. I was off work for months. She did all of those things for us because she had been through it, and now she paid that forward, because now I'm doing it too,
but which is wonderful, and that's the thing, isn't it? Is that your meeting with the GP at that stage is so important, and the outcome is so dependent on how much they know about neurodiversity. So it feels like the luck of the draw, right? It's just the luck of the draw of who you get, because you don't get to say which GP in a surgery you get. You just get assigned one, right? And if someone gets you as their GP, they've hit the jackpot. Fantastic, as you did with the person that helped you with your process
on this topic. But you could come and see me about something else and get the shit end of the stick, couldn't you? Because that's the problem is we have to know something about everything.
And I just think how many neuroshamblers have had the experience where they've been faced with someone who doesn't know what they're talking about and doesn't understand neurodiversity, so hasn't given them the best advice or hasn't validated their concerns.
Totally. I'm sure almost everybody has been in that situation. Sadly, there probably aren't that many of us who, The surprising thing about it is, I think, a huge proportion of the medical workforce are neurodivergent themselves.
Okay.
But possibly not acknowledged, let alone diagnosed. And that probably doesn't help either.
That's interesting. So then they don't recognise it as being atypical, because it's like, well, everyone is like this.
Normal round here.
That's interesting. I've not thought about that. I've really not thought about that. I've literally just come up with an idea, but I'm sure it's been considered. But shouldn't there be some sort of, it doesn't have to be a physical badge, but some sort of recognition that a GP specialises in neurodiversity. So if you have concerns around neurodivergency, you go to that specialist so they can tell, rather than just the dude who's really good at elbows or whatever that is. Is that a thing that's being...
It could be a thing For sure, and I think it should be. I agree. So that would, I think, we'd call it a neurodiversity champion, maybe.
Yeah, I like it.
In the practice, so that maybe each practice should have somebody who has done extra training, and often GPs do specialise. You can be a GP with a special interest in dermatology, women's health, whatever. So why not have GPs with a specialist interest in neurodivergence?
Would people get triaged to that then if you've got
And
someone
then, yeah,
I mean, with those other specialisms, people sort of triage to like, oh, you're
Yeah.
going to need the ankle specialist or whatever it is. Within a GP.
Yeah.
Why is that not a thing then?
Why is that not a thing? Good question.
Have
I think
just come up with the answer. Wicked.
Yes, we have. We've sorted it out. We can finish this
Great.
podcast
My work
now
is done.
and just let's think about how we'd operationalize that. I guess it's difficult, isn't it? Like, we all I don't see why that couldn't happen. It would probably, it's going to require incentives. So one of the things that I was going to talk to you about, just the listeners to know, I'm not sure how many people understand how general practice actually works.
No, please, enlighten us.
GP practices sit outside of the NHS. So the partners in a GP practice are business owners. They're small business owners.
Okay.
That have a contract from the NHS to provide NHS services to their local population.
All GPs?
Almost all, yeah.
Okay.
That's the model in this country, yeah. So I work for a GP surgery. I'm not a partner, but I'm employed by the partners. And so I'm not an NHS employee. I'm an employee of that business.
Right.
And the business receives a certain amount of money per head of number of patients they've got in the practice registered with them. It's an absolute pittance. So it's about £136 per patient per year.
Right.
So
okay.
Just think, and they have to provide all healthcare services to patients for that. Now, obviously, some people never go to their GPs. They'll go all year and not use any of that service at all. And other patients are in there every week.
Yeah, of course. Your favourites.
We think, and if you go to, when I take my dog or cat to the vet, £136 doesn't go very far, does it?
You wouldn't even get in the door at my vet's place for that. Yeah.
So actually, we're expected to provide a huge amount of service for very little cash.
Yes, of course.
And we do get incentivized to deliver certain services with extra cash on top of that contract.
What sort of services would you be incentivized for?
So in this sort of topic area, the one important one is ADHD shared care.
I was going to talk about shared care because that is, that's really interesting.
A huge problem. Yeah. So in general, the GP contract does not contract us to provide care, ongoing prescribing and monitoring for children and adults who are receiving medication for ADHD. So we have to be paid extra in order to do that.
Right, because obviously when, particularly with ADHD medication, the titration process takes ages. I mean, Otto is 2 years in, still no nearer. It's been a nightmare. And we're going via CAMHS, and Tam actually went right to choose and then was shared care with the GP.
But lots of GP surgeries won't do that shared care because they're not funded for it. And it requires physical health checks. You have to check your blood pressure, you have to be weighed. And, so that requires a nurse appointment. So that's something that has to be funded. All of this has to be resourced by the GP practice. And it requires us as GPs, I've got no specific training in prescribing for ADHD, so I wouldn't be able to titrate an ADHD medicine. That's not in my skill set.
Right, okay. So which is why it goes to CAMHS, because they are specifically, because that was one of my questions was going to be about, why can TAM be under the GP for shared care for the titration of medication, but all of our kids have to go to CAMHS, and CAMHS is almost like torture. The amount of effort and the amount of inefficiency and the amount of sort of hoops we have to jump through, like the current titration process with Otto is that we now have to take him back every single week. Couldn't that be with the GP? And you've just sort of explained that it could if they were being incentivized to do that, but they're not being incentivized to do that.
They have to be paid to do it, basically. Because
by who?
Who
pays them for that?
So it would be the Integrated Commissioning Board. So there are around the country.
Mm-hmm.
We all live in an area covered by an integrated commissioning board, and they decide what money is going to be spent on healthcare services in that area. So
Right.
they've got obviously a finite pot of a smaller and smaller pot of money, and they have to divvy that up and decide what they're going to spend money on. And sometimes they will if the services are struggling, like if CAMHS are struggling to see people weekly, or they will put the money into primary care and say, we're offering this, they call it a local enhanced service,
Uh-huh.
or we're offering this service, and GP surgeries can opt in or out of that. So that one GP surgery might say, yeah, we'll do that and we'll take on the shared care. Another GP surgery might say no.
So so that's interesting, is that regionally there will be these boards that decide where that pot of money goes, because the long and short of all of this is money, right? It's
Of
about
course.
funding and a lack of funding. So everyone's just trying to eke out whatever they can with what little money they have. And that pot is getting smaller and smaller. So I know that, really we have to look outside of the fact that, yes, we know that budget's an issue, but I'm interested in how that money is divided. And I didn't know about the boards that basically go, in this region, we've decided that CAMHS is overloaded. I cannot imagine there are any regions where CAMHS is not overloaded. Right. If you don't know what CAMHS is, just for the listeners, it's child and adolescent mental health services, where I think from the age of 11, is it, will then look after the kind of mental health care of children, and pretty much all ADHD referrals involve CAMHS to some degree, and it's increasingly overloaded, and experiences of CAMHS is universally shit. I think, like,
I
a
mean,
lot of really good people trying really
yeah,
hard, but it's not fit for purpose, I think, is.
at all. And in fact, how long have I been a GP? In my 16 years as a GP, I've had one CAMHS referral accepted.
One?
Yeah.
Really? How
Yeah.
come?
So because they never meet threshold. So this is for like mental health support.
Right. So the
So in
CAMHS,
the
so
area,
you do it directly to CAMHS and they look at it and go, no. And I'm guessing it's not, and maybe this is a presumption, but it's not on, they're not assessing on need, they're assessing on capacity.
yeah. So I think they have weekly meetings where they all sit around in a group going through all the referrals they've had, and they, again, they've got a finite resource that they're having to,
Yes.
and therefore the threshold to be seen just gets higher and higher and
Right.
higher,
Yeah. So
to the point where you are actually actively trying to kill yourself is the only people that get seen.
yes, I've heard that before as well, is that, they're not saying, if they reject it, they're not saying that this person does not have needs. They're saying that there are people with higher needs and they've only got a certain amount of budget and they have to be prioritized, which is deeply, deeply saddening and infuriating. I can completely understand it from Cam's perspective, but again, it's all down to money. I should ring a bell every time it all comes down to money at this
Yeah,
point.
I mean, nobody was hearing what we were saying.
Exactly. Okay, so you refer someone and then they say, I don't see enough evidence here, and they bring it back to you. As a GP yourself and as a parent of neurodivergent children yourself, do you ever, or can you, is it ethical to go, look, I know that they've rejected it, but you're not wrong. Your child is neurodivergent. Do you ever kind of on the slide just take to one side and go, you're not going crazy? Because that, I think, would be so important to some people.
Yeah, totally. I suggest it to some people without them coming to me
Okay.
with neurodivergence. I say, have you considered, and I say this to adults too, have you considered that you might be neurodivergent, or that your child might be neurodivergent? And sometimes they say, thank God you've said it. Yes, I've been worried about it. And sometimes it's left field, and that's a different conversation to have then. But I would definitely say, look, I totally see where you're coming from. I agree. I think this probably is ADHD, but I'm not qualified to make that diagnosis.
Ironically, because you are probably more qualified than anyone,
Probably,
having been
yeah.
through it and done all the
I am
reading
now,
and research.
yeah. But it has to be a multidisciplinary team assessment. So one person on their own could never diagnose it.
Yes, which is a good thing.
Yeah,
I'm not saying it's a bad thing.
definitely.
It's definitely good to get kind of a consensus on it. Obviously, it slows things down, which is slightly more frustrating, but it's necessary. So I've kind of talked about people coming into your surgery and your experiences of them referring them, but I'm just interested personally for you, which route you went down. You didn't go via the GP route, you went via the school route. Is that right?
Well, no, so we had a tricky. So my son fell off a cliff. Like I said, we'd not really
Right.
had any clue that he was neurodivergent.
What sort of age was that?
So he was in year 3 when he
Right,
started having
okay.
significant issues. So I think he was 8, sort of 7, 8.
Yeah.
And he started not wanting to go to school, and he'd been reasonably happy going to school up until that point. You would have definitely described him as a like emotionally sensitive, high needs boy, until that point. But he was getting on fine, never in trouble at school. Was behind with. We knew that he had reading and writing issues, but then he just fell off a cliff and stopped wanting to go to school altogether, and was saying things to me like, "I don't want to be here anymore," and "I hate school." And
Which
so
is
I guess
heartbreaking when
really
you
hard
hear
for an
that.
8-year-old
Like,
to.
yeah.
And I knew, I'm lucky because I hear lots of people say that to me in my job, that I think what he was saying, not that I don't want to be here anymore, but I'm finding things really hard.
Oh,
Help me.
yes, I don't want this. Whatever
Yeah.
this is, just make this stop. Not
Yeah,
necessarily,
exactly.
the ultimate, end point of that, but just I don't want this to be like this anymore.
No, but we were, both me and my husband were working full time. So I work full time as a GP. My husband is a children's nurse, a lecturer in children's nursing. He works full time at university. We're trying to get to work.
Yeah,
So
of course.
we're just shoving him into
Yeah.
school,
Mhm.
Distressed sometimes. I don't feel good about that now, but I'm sure lots of listeners will empathise.
Yeah, no,
have gone through the
absolutely.
same
I do,
thing.
certainly.
But looking back on it now, I realise that he was being traumatised by the school environment that he was
Yeah.
in. I'm very lucky. What happens when you're in the medical profession is that you have lots of friends who are also in health professions similarly as well. So you can talk to those people, and I'm really lucky that I have a friend who works at CAMHS in Ireland, and she'd spent quite a lot of time with us because we'd been over to Dublin to visit her a few months before, and she'd had time to actually observe my son in the wild.
Right, okay.
And she sent me a link and said, "Have you ever heard of PDA?"
Oh, wow, okay.
Send me the link to some, and I'd never heard of PDA. And I read it and went, "Oh,
it's crazy, isn't it? When you read that, that was with
terrifying."
Jay. I'd
Yeah.
sort of read up on PDA with Jay, and it was just like, finally, this is a
Yeah.
description of my child.
Yeah,
Oh.
my son's really sociable and is really, uses those ways of getting around doing stuff, or say
Yeah.
no very politely and make somebody laugh, or
Yeah.
look
Yeah.
over
Yeah.
here,
Okay.
really distract people. So he then stopped being able to do anything at all that summer. So we couldn't go anywhere nice, do anything fun, because he literally couldn't leave the house. And I think my friend and also the GP sort of mentioning the idea of burnout, because again, I hadn't really, I didn't know what that was or what that looked like.
Yeah.
So really sort of identifying what he was going through as burnout. And then school was so unhelpful, just gaslighting us.
Really?
They got some mental health advice for us, which was that we should make home less motivating.
Oh, God. That school told you that?
Yeah, well,
Sweet
that came from the mental health team apparently, and I was in a meeting with them, and they were saying, "So this is what you should do. So during the day, no screens, no games, only books and chores, and then then he'll want to go to school." And I said, "I'm going to stop you there because we're not going to be doing any of that."
Yeah, nice. Yeah, because it is
and they were shocked. What? You're not going to follow the professional's advice? Absolutely not.
If the professional's advice is ill-informed, then fuck no, is my answer.
Because as a GP, if I signed you off work, I would say to you, if I signed you off work for mental health reasons, I would be saying, do some nice things for yourself.
Yeah, okay, that's a really interesting perspective.
Have rest, relax, have lunch with a friend, go for a nice walk.
Yeah,
do
reduce
nice
your
things.
anxiety. Don't do bloody chores.
Yeah. So, absolute bullshit. So basically we arranged to go privately because I knew it would take forever. And I needed to know what was going on with him.
Yes.
Fast. And I'm aware that it's a huge privilege that we were able to pay to go privately. And we paid to have a combined assessment, so an ADHD and autism assessment, because we suspected that there were both things going on, and they and that was great. And he, because of the demand avoidance, and he was in burnout at the time, he wasn't really able to participate much in that assessment. He was hard, he did go with us to the first assessment, but he only managed half an hour there, really.
That is the third route that I did. I said there were two routes at the start. I mentioned the private route, which is one that we went down with Otto in particular, again, because he was sort of really unraveling.
We were just desperate, really.
Yes. So you get the diagnosis through. So as a GP, you've sidestepped the system. You tried it, and you were like, "No, this is. I need to turbocharge things a little bit." So then you go the private route, but you then, I presume, have to then get back into the system some way. Did you sort of then need CAMHS to accept the diagnosis to be picked up there?
So he isn't on medication, actually.
Right. Okay.
Initially, the psychiatrist that diagnosed him said, well, look, he's not at school now, so he doesn't need medication, which I don't think is a correct thing, actually. I think, actually, there are medications not just about being able to attend school. But anyway, we sort of accepted that he didn't need ADHD meds at that point, so we didn't pursue that until a bit later.
So you didn't need to go to the CAMHS route?
No, but more recently, we went back to the same private service and said, look, I think he is struggling with lots of ADHD stuff, and I wonder if meds would help him. But unfortunately, he doesn't want to take the meds. He can't see how they will help him. So he's not motivated to take them at the moment. So we haven't really had to go down that route yet.
So the private diagnosis was received, and that was fine. And you haven't really had to navigate the GP in the same way. You haven't had to navigate CAMHS in the same way. I think that private diagnosis is just what you need it to be at that time.
Yeah, and actually it also helped us. So we wanted to access the hospital education service.
Right, okay.
Which is the service in our area which provides education support to kids who can't go to school for medical reasons.
Right, okay. And you could do that with a diagnosis?
Yeah, so in most cases, so I imagine this is, again, it will be different in each area, but in our area, that referral for the hospital education service has to come from a specialist, so it can't come from the GP.
Right.
And the child is meant to be under that team for ongoing care, so CAMHS can refer if the child is under CAMHS. And we were lucky enough, because I didn't even really know about that service, but the psychiatrist who assessed my son also worked in the CAMHS service, so knew. And that's what you'll often find if you use a private service. The clinicians running the private service are often also working in the NHS as well, so they understand the pathways locally. Right.
Okay.
So she contacted the hospital education service and said, would you accept a referral from me privately? And they said yes. So that helped us to access the hospital education service.
Okay.
Which meant a tutor coming to our house that he never engaged with, obviously.
The amount of times we fight for the support for our kids and they're like, nah. Not for me. Medication, nah. Tutors, nah, not for me.
But actually it provided lots of evidence for us to show that if he won't engage with a tutor in our house, how the hell are we going to get him to any kind of school?
Yes, of course.
Which I think it was really good for evidence collecting.
So one of the things we touched on earlier was training and the fact that medical students are not trained in neurodiversity. It certainly weren't back in the day, but probably aren't now from your understanding of it. And you mentioned when we sort of spoke previously before this about the Oliver McGowan training that is now available to GPs. Tell me more. I didn't know this was a thing. So is this available to all GPs?
Yeah. So can I give a trigger warning though before I talk about it?
Please do. So just
as trigger warning, this involves some difficult, sensitive discussion about a young man's death. So okay. Just to sort of flag that up.
Thank you.
People might want to just mute for a short while. So Oliver McGowan was a young autistic man who lived in Bristol, which is where I live. Mm-hmm. And Oliver, as well as autism, Oliver also had epilepsy.
Hmm.
And in 2016, he was admitted to hospital because he was having seizures. And because the medical staff didn't listen to his parents, he was administered medication he had previously reacted very badly to, and Oliver
Right.
died. He was 18.
Wow.
So it was tragic, and the coroner basically, said it was an avoidable death. Emblematic of the systemic failures in healthcare communication, consent, and understanding of autism and learning disabilities.
Right.
And then his mum, Paula McGowan, who is now Paula McGowan OBE,
Ah, nice.
just
Okay.
took this on like a hero, despite her grief, and
Hmm.
really fought tirelessly, taking this to her MP, and then that was taken to Parliament. And it's now been included in the 2022 Health and Care Act that all CQC registered providers, so that's all hospitals and GP surgeries, must ensure their staff receive learning disability and autism training appropriate to their role.
Right. Okay.
And through that, this training, which is actually named after Oliver, so it's the Oliver McGowan training, has been developed, and that is now the recommended training, so it's mandatory training
Okay.
for
Brilliant.
all NHS staff. So there are two tiers to it. The first tier is like for people who have non-clinical roles, so reception staff,
Right.
admin staff.
And they have to have it as well.
They have to do this an online training
Okay.
package.
Great. Hmm.
And then clinical staff who have direct face-to-face contact with patients have to do tier 1 and tier 2, which is a whole day of face-to-face education.
Okay.
That has to be co-delivered with people with lived experience. So
That sounds wonderful.
it's really good. Yeah.
And so you've been on that training yourself,
Yeah.
obviously.
Yeah.
And, be honest, how good is it?
Well, I thought it was really good.
Okay,
I
good.
will say there are mixed reports of it. And I think this is the problem, that you will always get people who they're not interested in this topic. They don't see how it's relevant to them.
Yeah.
And they're part of the problem, aren't they? And
Is
there
that-
will always be those people.
Do you get medical people like that, though?
Yeah,
You can't really.
unfortunately.
Is it what people who are like, I'm not interested in this because I'm a knee guy.
Or I
Or-
know everything about this. Yeah, no, absolutely. How is this relevant to me? I'm an orthopedic surgeon. But you
I
do
was like,
see
you're
patients-
good. You're going to be operating on autistic people, dude.
No.
Yeah.
So,
Okay.
I mean, I think you have to realise that doctors are a microcosm of the general population, in that you have that wide variation of views. And
Yes, but I think a characteristic of all people in the medical profession is a desire to help people and a caring nature. However, you are also going to get people who are know-alls and wrong-uns, and a very, very small minority. Yeah, they actually are. But that was one of the questions that I was going to put to you, because with that caveat that they are essentially just a cross-section of the populace to a greater or lesser degree, without wishing to ask you to throw any of your fellow practitioners under the bus, are there people who are skeptical of neurodiversity, as there are in the wider population? Because it is really frustrating sometimes when you hear people say neurodiversity is just a fad, it's just a trend, it's not, it didn't exist when I was when I was growing up. Do you encounter people that actually have those views and essentially the gatekeepers to the help that people need?
So I think it would be a minority of people who would say that neurodiversity wasn't a thing.
Mm-hmm.
But so I'm in lots of Facebook groups with other doctors.
Right. Okay.
And so I see a whole range of views written, and often what we write on social media might be different than what we would say in a face-to-face discussion.
Yes.
But I do see there are lots of people who think overdiagnosis is a thing, for sure.
Yeah.
And that often these are parenting problems presenting themselves. Particularly, and I will admit that I would have thought this myself as well, that idea that they're fine in school but they're not when they get home. Well, obviously the problem's at home.
They
isn't
need
it,
they need more discipline,
Yeah,
and all
exactly.
of this, just for the record, bullshit.
Bullshit, absolutely. And I would say that as well is worse, I find, in my own experience and my own views, you know what we're like before we have kids as well. That's even worse.
Oh,
isn't it? So I was a
yes.
GP
Yeah.
before I had, before I
Okay.
had
Yeah.
a child. So, it's like people giving you sleep advice, isn't it, for babies? Just put them down and leave them. I mean, I would
Yeah.
never give that advice, obviously, now. But I think there are people with very limited experience of the world who think overdiagnosis is a thing. And
Yes.
yeah,
That is interesting, actually, because you'd never take parenting advice from anybody who doesn't have kids.
no,
Because you don't fucking know. You think you do. You think you know. You have no
yeah,
idea. And it's the same thing. Like, I wouldn't take parenting advice for neurodivergent kids from anyone who doesn't have a neurodivergent kid, because you have no idea. You just don't get it. But that must be really frustrating if you're going to your GP for help and they are the people that you're getting. They're the people that are able to kind of progress you to the help that you need. And
it's trauma is what it is as a parent, isn't it?
Yeah.
That is trauma because
Yeah.
it's gaslighting.
Yes. And I know a lot of neuroshamblers have had that.
Yeah.
Some people send me emails about that kind of thing. And a guest I spoke to recently had that, just pure gaslighting.
Yes. And that whole, at the worst end of that spectrum, I'm not going to get the term right. It's what we used to call Munchausen's by proxy, but it's fictitious.
Fee,
yeah.
Which previous guest, Danielle Yata Hall, was accused of.
Yeah.
Fee is fabricated or induced illness, and it's
and at the worst end of the spectrum, that's what that is, isn't it? Where you're saying you've presented
you're
your
making
child
this
with
shit
this.
up, basically.
You're making it up.
Yeah, and you're putting ideas into their heads, and which is
and I'm going to make a safeguarding referral about
which is harrowing. And as I say, if you want to hear a little bit more about Fee, which is not an easy listen when it when you hear Danielle Yata Hall's experience of it, but that is in the medication episode of Neuroshambles. I can't remember the episode right now, but look it up in season 2. So you're greeted by someone like that as a parent, because I'm sure that there are some listeners who have gone through that. What do you recommend they do if they take something to their GP and the GP is just not clued up enough and is not listening? Is there anything they can do?
So there are two things. So one is just cut your losses. If you realise partway through the consultation that it's not working and this person isn't the right person for you, I would just get out of there and think about trying to get back in with somebody else. So most GP practices have multiple GPs.
Can you request someone else? Go, look, I want to talk to. Can you actually say I want a second opinion? Is that a thing?
Definitely.
Wicked.
Definitely.
Oh, I'd love to say that to someone.
Yeah, I'd like to talk to somebody else. You could ask. So if you're in a Facebook, I'm in lots of Facebook groups with other parents of autistic kids and so on. If you're in one of those groups, why not put a post on there? Anybody got experience at this surgery? Is there a particular GP that's
right?
Good?
Yes.
Try and find out if there is a me.
Yeah, absolutely.
And try and get to see them.
Can they request that then if they phone up reception and go, okay, good.
Yeah. You might have to wait. That's the thing. If you want
You're
to
worth the wait,
GP.
though.
I try. The other thing you can do is you can make a complaint. You can complain to the practice manager.
Yeah.
If you and I would just be very specific about that. If somebody was unprofessional or you weren't happy with the service that you got, then I would complain to the practice manager.
Yeah, because it needs to change, doesn't it? It's really important that we're not gaslit. People in their time of need are not invalidated and and given the wrong advice. So so conversely then, if you've encountered fellow professionals like this, is there a complaints procedure internally that you could do?
Yeah, so I think if I worked with somebody like that, I would flag that to my line manager, definitely.
Okay.
But it's very difficult, for instance, if I'm in a Facebook group with people and they've just got shitty views that they're posting on Facebook about what they do, there's very little that I can do. They're
anonymous, aren't they? Yeah.
Well, sometimes they are, sometimes they're not.
But it must be exhausting when you're on those groups and then you meet that. It's like, oh, God, now I have to correct you.
So I'm also in groups of medic mums with special needs kids, and I'm also in a WhatsApp group of doctor mums with PDA kids.
Oh, wow,
so,
okay.
Niche.
Yeah.
But we'll often say, oh God, look at the post on such and such group. Can anyone wade in and help me?
Yeah,
and we'll then wade in onto the comments and
I'm
be
tagging
like,
out of this one. It's you.
yeah,
I could tag someone
exactly.
else in quick. Someone needs to
Yeah,
correct
because
this fool.
actually, if multiple of us can go in, and then maybe it does shift people's views a bit. Actually, if they realise they're outliers in terms of their colleagues and their peers, maybe that, if we can direct them to some reading or.
I mean, it is worth pointing out that these people are in the minority. I think,
most GPs and clinicians will do whatever they can within the constraints of the system to help people.
Mm-hmm.
And sometimes, despite whatever, I would want to do, just all I can do is listen to people and affirm what they're doing. So, and I think that's powerful. I hope it's powerful. Sometimes all I can do is say, you're doing a brilliant job. This is really hard.
Oh God, that would, that's all you need sometimes. Seriously, like, just, oh, thank Christ, I'm being seen. You know, I'm not going crazy. That's, oh, dude, that would mean so much when you're at that moment of, because you're going to the GP because you need help. You're not going just for a chat and a cup of tea. You're there because, like, I don't know what else to do. School is saying no.
I share information about, I'm not, not tons of details, but I share, I've got an autistic son too. I understand some of this.
Yes, which is so important.
Because again, I found that helpful with my GP. When my GP said it to me, I found it really, because you feel like it's not just me, like, and it's, I don't know, wrongly, I think some people put GPs on pedestals. So I think it can be really helpful to say, God, even my GP's got this problem.
Yeah, absolutely. Another question I had, because, and again, this is sort of similar to the prevalence of skeptics, people who don't believe that, or who believe that neurodiversity is being overdiagnosed, is that you very often hear ill-informed people saying it's just a fad, as we said before, or loads of parents are just making it up. This is the one to abuse the system. They're just trying to take advantage of the system. And that is deeply frustrating when you hear that, because it's wrong on so many levels. But I'm genuinely intrigued to know if there are any parents that are doing that, are seeking diagnosis for whatever reason that is not valid, to game the system. I don't know why you would do it, why you would put yourself through this fucking paperwork.
No.
But is there any evidence of a single parent who's come to you with their child and gone, I'm pretty sure that my kid's neurodivergent, and they're doing it to game the system?
Nobody. Zero. Nada. No way. I mean, it's
ludicrous, isn't it?
Completely ludicrous. And I had this conversation with a friend of mine actually not that long ago, where she said to me, of course there are people that are trying to game the system, aren't there? And all those people who are really autistic, that means it's hard for them to get support because there are so many other people. And I just thought, I just don't know where to begin.
Yeah.
Because as you just said, who would put themselves through the torture that we have to go through to get any support at all? These people are desperate parents, aren't they? These children are on the edge of society. They're falling off a cliff, in education. It's ridiculous. I'm going to be controversial.
Please do.
About diagnosis.
Yes.
And say that I hope that one day in the future we won't need to put people through diagnosis. So in my mind, and I'm aware that some people will not agree with this, and that's okay, these labels are man-made social constructs. And I say man-made, I mean man-made, because they're made by men largely. And we're pathologizing people for something that is actually completely natural. Like, there's nothing wrong with people who are neurodivergent.
Yes.
They're not deficient. Yes. It's not a medical problem.
Yes.
And we're also squeezing people into boxes that often they don't fit in. So, my son, the reason he's got so many labels, because he doesn't fit neatly into one box.
Yes, exactly. And also, if you're autistic, which facet of autism
is
exactly.
It? So I think it's, I can understand labels can be helpful to get support and things like that. But in my mind, in my utopian society of the future, we won't need to put those labels on people. People will be supported to identify what their needs are and what things they need to help them.
but we won't need to put people in boxes. What I'm absolutely not saying, for the benefit of the doubt, is I'm not saying that it doesn't exist, that people aren't different. Absolutely, it's clear that all our brains work differently.
The diagnosis, I think, is more for other people than it is for us, because we already know, right? But by the time you kind of go for that help, pretty much, you already know that there is something different about your child. You might not know what that is, and even when you do find out what that is, you're not going to suddenly have all the answers or have all the strategies. But it is useful to go, can you just back off a little bit because he's autistic, right? And should you be asked for the paperwork, you go, there, you see, fucking 4 years it took me to get this, back off. But it is frustrating when you have people that think that that diagnosis suddenly opens up this trove of riches that we can help ourselves to, and we can buy loads of shit and we can access loads of support. Nobody wants to put themselves through this. No one. You don't get people with neurotypical kids who are sitting there constantly going, why isn't my child like those children? Why does my child not respond in the same way? They don't have that doubt because their kids just fit in. There might be a few nobbles and a few lumps, in terms like from the main blueprint of what your child should be, but largely they're not standing out. And that's why they're typical, right? They're neurotypical.
But it's exactly the same as, like the Black Lives Matter conversation, isn't it? It's it's having the privilege, being in a privileged position of having neurotypical children means you have no understanding at all of what it's like. It's the same as white privilege. Neurotypical privilege is a thing, isn't it? Where you can't possibly know what it's like on the other side, and it is frustrating. But I feel like I've got hope. I am hopeful, because I think the generations, after ours, they're much more open-minded about stuff. They're much more fluid about things like gender, and I think neurotype is another thing that they're going to be fluid about.
Yes, definitely. But what I think this sort of the nub of my question about that, right? About are there people just making shit up? Is that when you are a parent going through this process and going through this system, it feels to me that the very first point of contact with any professional is that you're not believed, right? And you have to then provide a mountain of evidence, and you have to go through so many hoops to prove that you're not making shit up, right? And that would only really make sense to me if there was a load of people that are making shit up. So why is the first, and this is not me having a go at you, by the way, I know this feels like I'm having a go at you on behalf of your profession, but why is the initial point of contact to not believe the parents? Where does that come from?
I think it's worse now because the system is so stretched. And so we are in a sort of rationing mindset.
Yes. Okay.
So I think that's part of the problem.
Yes.
I think the other part of the problem is that we know that there are, the number of people seeking diagnoses is increasing, and that isn't because people are making it up.
Yes.
It's because of a combination of factors like increased awareness. And I firmly believe, and again, I don't want to throw individual teachers under the bus, but the education system as a whole is increasingly rigid and not a good place for neurodivergent children.
Right, okay.
And that is causing these problems to come to a head. So things that, years ago when I was at school and the teacher could adapt their teaching and teach us whatever they wanted to teach, that suited neurodivergent kids, and they would probably manage without very much help. But nowadays, because everything is so rigid, because there's so many assessments, there's so little playtime, all of those sorts of things, is putting huge pressure on children in schools, and that's why we're seeing more of it, I think. One of the reasons.
That's interesting. And so you're saying that there's that the skepticism that I'm perceiving might not be skepticism, but it's essentially a filter for, how do I allocate my very sparse resources because there are people with greater need, and it's needs assessed. Who has the greatest need for my little tiny pot of gold?
If you've been a GP for, I've been a GP for 15, 16 years, I've seen in that time an uptick in people coming to ask for referrals for diagnosis.
Yes.
If you were ill-informed, you would be thinking, what are the reasons behind that?
Yes.
Is it because people are making it up? Is it because it's now, TikTok influencers encouraging everybody to go and get an ADHD diagnosis? You may start to think along those lines rather than the other things that we've talked about.
Which is, like people just being aware now that's what they've been doing. They've been masking for 40 odd years. Yes, and that's actually what this means.
And then you start looking around at all your friends and colleagues and going, oh, you're all neurodivergent.
Yes. Yeah. I put out a call for people to submit listener questions because I thought it was quite interesting, because I haven't been through the GP pathway. I went through the school pathway and the private pathway. So I was interested in whether people had questions that they wanted to ask you. So I'm just gonna read them out, if that's all right. And then if you feel able to answer them, please do. So I had a listener question from Hannah on Facebook, which was, what support can GPs offer for families with neurodivergent children beyond asking for a referral for the ND diagnostic team, which we've obviously been through? I've not used them on our journey. I've tended to work with the paediatric team, occupational therapy team, with providing evidence for annual review meetings in school. If there are ways the GP can help, I'd love to know more. So what don't we know we can ask for, I guess?
Yeah. I mean, we're often in a position of coordinating care. So we receive all the reports in. We're often the ones that are holding it all together. Perhaps that might not be obvious sometimes, and you might need to give us a nudge occasionally. But we ensure that communication between services happens often. And sometimes we can chivvy referrals along. I mean, again, with diagnostic things, we probably can't, because the waiting list, they are what they are. And but if it's for something like CAMHS for mental health support, for example, if things change whilst you're waiting to be seen and things become more urgent, we can sometimes write letters to expedite referrals.
Does that work then? If you can say,
sometimes,
get a move on, and they're like, oh Jesus, Lucy's on to me.
Well, sometimes we can say, like, actually things have changed, he's really deteriorating, I'm really concerned, could you see them sooner?
And that carries weight. Okay, well, that's good.
Yeah Some GPs, and I would say that this is some, not all, will write letters of support for things like EHCPs, DLA, those sorts of things. Those letters fall outside of our NHS contract, so they're often seen as private work, and you might have to pay for them.
Right, okay.
So again, back to how I described general practice sits outside the NHS, and we're only contracted for certain things. So if you ask for letters which aren't NHS work, so writing a letter for DLA, for example, wouldn't be considered NHS work. Practices might charge you for that.
Right, it's the practice that's charging you. They're not you as the GP sitting in the back of the pub going, I'll sign your DLA form. No, okay.
Exactly.
Yeah.
The practice charges for it. That, again, that's pretty variable. And some GPs just won't write those letters.
Okay. Why?
They don't feel it's their job sometimes. So there'll often be statements of fact. Their mum tells me that X, Y, and Z, because often, again, I can't say little Tommy can't tie his shoelaces or whatever, because I haven't assessed that, so I can't say. So we're going to be limited to what we can say. We can signpost people, so often we know about local services that you might not know about.
Right. Yeah.
So we can signpost to other places that you can get support. And I think one of the biggest things that I do as a GP, where I think our role can be limited sometimes, but I am providing support to parents and their mental health.
Yes.
Because as we know, that this is and one of the things about GPs is that we look after whole families, and that's what our model is based on. We often know everybody in the family. And so when we see an individual, we're not just thinking about that individual, we're thinking about their siblings, and we're thinking about the effect on the family as a whole. And so I often, if I see mum or dad might come to talk to me about a child, and I might clock that they're really struggling themselves and say, look, why don't you book an appointment with me to talk about your mental health?
That's exactly what Tam had. Was incredibly valuable to Tam when, I think the GP was just like, have you thought about yourself? As in,
Yes.
look after yourself. And I think that was
Put
the
your
little
oxygen mask on
yeah,
first.
exactly. I think that was a nudge that Tam needed. So it's a really valuable it's a really, really valuable service that you do.
And the other thing to think about is lots of children with autism and also other learning disabilities. So if you have a diagnosis of a learning disability, then you're entitled to an annual health check with the GP.
Okay.
So we will also do those. So they're physical health checks. So we know that children who have a learning disability or are autistic, their physical health is often worse because they find it difficult to access healthcare.
And also might not know that something's wrong, the interoception issues.
Exactly. So we should be offering annual health checks to people with learning disabilities and autism. I hope that helps, Hannah. It's not, we're not magicians.
It's just useful to know. Okay, another listener question I had was from Rachel via Facebook, which was... This is a very specific example, but I think it speaks to a broader thing. Why can't GPs sign a flex form for homeschool learning? We've had to wait 2 years for CAMHS to sign, leaving my 15-year-old without education for 2 years, which is obviously frustrating. And I imagine that you're not able to discuss specific cases or comment on behalf of GPs in different LAs, but it speaks to that thing we were talking about earlier about CAMHS being the gateway to the support that we need, but it's so overwhelmed and underfunded that we're just kind of stuck in limbo like Rachel is. Is there a reason that GPs can't be used more for that sort of support?
So I think a couple of reasons. So one is we don't have the training to make decisions about what education is appropriate for an individual child. And often, as I said, we often don't see those children very much. So
and I presume, does it have to go to more than one person? Again, it's not just a single person signing this off. It'll need to go to a team.
I don't know, actually. And I imagine flexi homeschool learning, really, this is an education decision. And I know this is really unhelpful because as parents, we often get stuck between education and health, who all seem like they're being really unhelpful. But the decision as to where a child receives education should be taken by education. It isn't really a healthcare decision at all.
But then CAMHS isn't education, is it?
No. But again, I think this is similar to, I said in our case when we were referred to the hospital education service, a similar sort of idea to that the GP wasn't able to sign the form then, and not because they weren't willing to, just because somebody has made a decision somewhere that it can't be a GP that signs it.
Right. So then if you bring it back to Rachel, who's trying desperately to get this help for her child.
It's so frustrating. Yeah, I've got no great answer for Rachel in that. I mean, luckily, it sounds like, hopefully, I don't know whether that's been resolved or not, Rachel. I hope it has. I mean, in some respects, often we get asked, for instance, to write letters for pupils being absent from school, for example.
Yeah, okay.
So, like in my son's example, when he was off with burnout, without an EHCP or anything initially. And in those circumstances, the Department for Education guidelines actually says that schools should be authorising the absence of pupils with mental health problems. And you shouldn't need medical evidence.
Right, okay.
So you don't need to ask. So you should be pushing back to school.
So you push back to school and going, you sign it, guys. Yes.
Well, you should be able to authorise the absence. He's unwell.
But then that's where scepticism comes in, isn't it? Where they're like, I don't believe he's
unwell.
Parents
should be believed. No, I know. Again, why would you have to take time off work yourself in order to look after your, I mean, it just doesn't make any sense, does it? So I think a GP can write letters saying this child has presented with symptoms of anxiety and they're not able to leave the house. That they can write statements of fact letters like that, but very few GPs would feel confident actually signing a form to say this child needs this type of education.
So for whoever's made that decision has decided that CAMHS is in the best place to sign that form.
Yeah.
CAMHS is overloaded, underfunded. budget bell again. Ding, ding, ding.
The other thing just to say is, and people will be aware of this, I'm sure, that our appointments are like 10 to 12 minutes long.
Is that all? So you, I mean, and now, as you said, you could probably diagnose someone in that time.
Yeah.
Like anecdotally, you go,
yeah.
However, that's not official, and you need additional evidence and that side of things. But yes, it's a very time limited, your interactions with these people. So
yeah. And the other thing is prescribing. So I know the other thing that lots of people ask about and get cross about is GPs that won't prescribe certain medications to children.
Yes.
Melatonin being a big one. So melatonin in my area where I work is restricted. So we have something called a formulary. So I can only prescribe drugs that are on the formulary.
Okay.
And each drug has got a colour. It's like a traffic light system. So green drugs I can prescribe freely in primary care.
Okay.
Amber drugs have to be initiated by a specialist, and then once they're stable on that drug, the GP can take over prescribing.
Right.
And red drugs are specialist prescription only. And in my area, melatonin is a red drug.
Really?
It can only be prescribed by a specialist.
What's the reason for that? Just anecdotally.
I do not know, because in America, you can go and buy it in a flipping health food shop, can't you?
I mean, I'm not getting into the specifics of why melatonin is designated a red drug. Melatonin is certainly something that autistic kids seem to have a deficiency in, and it definitely helps with the sleep patterns. So I know for many parents who literally rely on it just to stay sane when their kids can actually get to sleep at a reasonable hour.
Totally.
It's really important, but you can't just write that prescription because it's a red drug.
Yeah.
And
other drugs like anti-depressants, for example. So often we have young people waiting a long time to see CAMHS for antidepressants. I can't prescribe that. Really, I wouldn't prescribe that to somebody under 18, really.
Yes, okay. But because then they need to go through someone who has specific training in that side of things, and presumably, would be cross-checked by a fellow professional as well to make sure that we're not just dishing out very strong medication for kids without a second opinion.
Exactly, and some of it's about risk, initiating. So antidepressant initiation in young people is associated, very rarely, but is associated with suicide in young people.
Yeah.
And so we would want them to be under the care of a specialist team when they were starting that medication. We might then take over the prescribing of that later on, but
yes, and that was the thing, is like when that happens with shared care, for example, is that the kids will be titrated onto a specific medication, and then with shared care you can then refer back to the GP who says, okay, I am happy to, and you discussed earlier, you can then be funded, you can be incentivized to pick up that and then continue prescribing that medication because that they've been assessed properly and responsibly.
And it's about who holds the risk, really. So the specialist still holds the risk for so often with shared care, the idea of shared care is that the specialist does annual monitoring still, so they should be having an annual review with a specialist, even though we're doing the ongoing monthly prescribing.
Yes, okay. Let's just very, very quickly touch on right to choose, because this is something where the CAMHS waiting list is so long. Again, it's back to CAMHS, that you can request a diagnosis via a private clinic, which would then come back into the NHS once that's done. It's a process that I did with India, that Tam and I did with India. If you want to know more about that process, listen to the diagnosis episode that I recorded with Tam. I'll put a link in the show notes for that one. But that was back in season 2. But my question really is that we had to specifically request it. We found out, I'm not quite even sure how we found out, but it wasn't offered to us. We had to specifically request it, and then the GP went, oh, yeah, fine. We didn't know it existed until that. Is there a reason why parents aren't offered it at the outset?
So, I think that's a lack of awareness.
Okay.
I don't think there's like a...
They're not holding on to it.
Conspiracy. No, I don't think so. So I think, I always offer it. In fact, in my practice, if somebody inquires about ADHD referral, we have a text message that we just send to people with all the right to choose providers on the links to them to say, just have a look through those.
Take your pick.
Let us know which one you want to. Yeah, basically.
I was interested in if there was some kind of financial reason, because obviously, the NHS has to pay for that. And then, is there a reason that they don't have the budget, so therefore they'll only let it out
I
to
imagine
people?
they're contracted. That's a block contract to that provider to provide assessments. I doubt it matters how many people we're referring.
Okay, so
yeah,
if you're considering right to choose, just ask. And then
so the key things to ask for, though,
yes,
the key things to look for is what that provider will offer. So often some of them will just do assessments.
yes,
But if you're going down the ADHD assessment route, if you think you might want medication, you need to know, will that provider offer initiation and titration of medication?
yes.
And will they offer ongoing shared care with your GP? Because not all of them do offer all of those things, and then you might get stuck with just having a diagnosis and nowhere else to go.
Yes, and if you then end up doing titration and medication with that provider and they don't do shared care, you're then going to have to pay for all of that process from a private clinic, which is not cheap, guys. So yes, that is a really, really valid point. Thanks for that. One other question I had, and it really speaks to what the main crux of the topic of this episode is the system broken? And the reason that I ask that is because people's experiences with their local healthcare system is so wildly different from everyone that I speak to. Some people say, oh yeah, I got my child diagnosed in 9 months. And then some people are like, nah, dude, it's been 14 years. It's still not diagnosed. I'm exaggerating, obviously, but it is very often you hear very often that it's a postcode lottery. And I looked to try and find some statistics on this because it'll be useful to know, an average weight in Kent is this, whereas in East Sussex is this, and you can see the disparity. It's really, really difficult to find that evidence. I've only got anecdotal evidence, but I know that people in parts of the country have a much harder battle to get diagnoses, and they have to wait for much longer than in other areas of the UK. So we're all part of the same NHS. Why is there such a disparity?
Are we though?
Oh, here we go.
That is
Strap
the problem. Here we go. Because you think that the NHS is a single entity,
right?
And it's not. Well, I mean, it sort of is, and that the funding all comes from the Department for Health and Social Care, and that goes. Remember earlier I talked about integrated commissioning boards. So locally, our healthcare is funded and commissioned via these ICBs, as they're called.
Yes.
So the ICB receives a pot of money from the Department of Health and Social Care. I guess that is something to do with how many people live in that area and what their needs are. So things like deprivation and stuff will probably play into that.
Probably age as well, I would imagine.
Probably age, deprivation, those sorts of things. So they get this pot of money and they have to make a decision what to do with it, and that's where the postcode lottery comes in.
Right.
That's why we get wildly different service models from one region to the next.
How many ICBs are there?
Oh,
just roughly, finger in the air. Are we talking about like hundreds, or are we talking about like 4?
No, probably 20, I would say, in England-ish.
Right.
So they sort of roughly conform to sort of county-ish.
Yeah, okay, so they might team up, like might have 1 or 2, but 2 counties in one.
Yeah, so in my area, at the moment, it's Bristol, North Somerset and South Gloucestershire is one ICB.
So that's an ICB. They'll be given a pot of money, and then they will choose how to prioritise where that gets spent. And obviously, one part of that process is mental health.
Yeah.
And would neurodiversity, that would be encompassed by their mental health budget? Or is it a different thing?
It might be a separate budget. It might come under sort of paediatrics, or again, there'll be an adult and children's service. Right. It might be completely separate. It might be viewed completely separately. But I mean, it certainly is going to be. Is an important thing that ICBs have been thinking a lot about.
Yes.
So in my local area, a few years ago, our waiting time was about 5 years, I think, for an autism assessment.
Okay.
And they had this radical idea that they were just going to re-triage everybody on the waiting list. And if you didn't sound like you were serious enough, they were going to bump you off the waiting list, regardless of how long you've been on there for, and give you a lesser I don't know what it was, not an assessment. But there was a huge uproar, and that they quickly shelved that idea.
If you weren't serious enough, in what way? Like, as in you weren't autistic enough?
You weren't Rain Man enough, yeah.
What, are you shitting me? Oh my God.
I don't know how they were going to make the assessment, because again, you're only relying on the quality of information that was put in the original referral,
Also,
which could be 5 years old by that time.
Yeah, and you can't, like, depends where the person is, right? Like, if you take Otto into the middle of a meadow, he's absolutely fine. If you drop him in the middle of a shopping centre, he really fucking needs help.
I think we talk about the broken system and people don't quite understand, like, we are in desperate times, basically.
Right,
These
okay.
commissioners, I wouldn't want that job, because they're making decisions about, should we spend this money on cancer treatment?
Yeah, and everyone needs the money. Fundamentally, they're cutting a very small pie and having to feed lots of people. And so, as you say, they're tasked with making that incredibly difficult decision of how to carve very meagre rations. And some will prioritize, neurodiversity more than others, I guess. One of my questions... it comes back to the scepticism thing. It's down to people. These are people making decisions. So if these people are skeptical, or they don't understand neurodiversity, or don't appreciate that it is a problem rather than a fad, then they're going to be less disposed to proportion that the budget for that. Is that why we see such a disparity in the different
I think
regions?
That is part of it. So it will depend on who has got the loudest voice in those decision-making meetings. And so, yes, I think it will depend on whether there are people that have an understanding of it.
So if we go up the chain, then how do people get onto those boards?
Well, they apply for jobs on there. I mean, some of them are clinicians,
right?
So some of them are, doctors of different, and nurses and other healthcare professionals. And it's a leadership position,
Right. So it's not voted for. It's not an election. No. It's just like, I fancy doing it. And it could be, I mean, obviously people who are very experienced and very, very accomplished in their field, but they might have a very different view of neurodiversity than others. And there's no one gets any kind of say in that.
Yeah. I mean, part of the thing that feeds into the integrated commissioning board are that there are these things called GP collaborative boards. So representatives from all the practices in the area of GP practices meet regularly, and that feeds into the integrated commissioning board is a board of people. So it's a big group of people that meets. But decisions will also be made, I imagine, in little meetings, committees that are offshoots of that main board. And again, it will depend whose voices are in that room.
Yeah, absolutely. And I'm aware that I'm sounding like a conspiracy theorist here. Like I don't believe.
You're right. It's human nature, isn't it?
But I don't believe that there are like loads of skeptics right up the top.
No.
Stop. Like that's not what I'm saying. I believe that the vast majority of people are really, really professional.
If there aren't people championing
exactly
neuro-affirming pathways, then we won't get those neuro-affirming pathways.
Yes. I think that's, so if you are, you're a very, very well-established medical professional and you're hugely neuro-affirming, can you apply for those jobs on the ICPs, please? And let it filter down. It's like you say, it's not a fun job to do, is it? But that is really me just trying to understand a little bit more about why the different, why there's such a disparity. And I think that makes sense. And I'm sure it's only one of the different reasons for that. Is there any others that could be at play here other than the local experience, other than the training and understanding of individuals?
The other thing is, so on the ground, clinicians will be developing ideas for services and putting those to the commissioning board, saying, look, we could run a service like this. Here's a business case that we could run this service. So again, it depends a bit on the clinicians on the ground and how much time and energy they've got in terms of putting together those ideas for improving their services and offering those different ways of working to the ICB. But again, in an overstretched service, creativity is thin on the ground.
Just energy. And I can imagine.
I would just say, because I think, if you work for CAMHS or any service like that, a bit like being a commissioner, I imagine working in CAMHS must be soul destroying.
Oh, again, my God, I can imagine.
Knowing like the moral injury of having to reject referrals.
Yes.
That you could help that child, so I want to shout out to everybody working in CAMHS, really.
Yeah, the institution is very much maligned. It is, again, largely down to budget rather than incompetency. I think there's a lot of systems that could do with being improved, and processes that could be doing improved. Certainly in terms of the admin that we have to fucking go through just to be part of the process. However, again, that's probably budgetary as well. The fact we have to fill out handwritten forms, for example, all of this is to do with budget. But the people within CAMHS, within the NHS, are trying really hard. And, as you say, it must be really disheartening for you as a GP as well, to be forwarding people to these services that are probably going to say no. And that's not because the people in front of you don't have a need. It's because they don't meet the criteria, or they don't meet the threshold for what qualifies as getting support.
Exactly.
So let's look forward a little bit. I'm interested, right? Because you have an inside view on the NHS and the healthcare system. Let's just assume, for the sake of argument, that the system is fucked. Right, let's take that as our baseline, okay? Or, certainly in need of repair. It's crumbling. If we were to put finances aside, because I know that the answer would be, let's give it more money. And then that money can be apportioned, people can be supported and helped. Like, if we had unlimited money, that would be great. We could update all the systems, we could give all of the services the money, and people will get the support they need. That'd be amazing. And you wouldn't have to reject people. However, that is not realistic. Just putting that aside, let's just imagine in some crazy world that money is no object. What do you think would help?
So I think we need a cultural shift, don't we, across society, but in healthcare. And I think that starts with training of in undergraduate training.
Okay.
Nurses and doctors in their undergraduate training from the get-go need the concept of neurodivergence, and neuroaffirming practice and the idea that it's everybody's problem.
Yes.
So we don't get orthopedic surgeons saying, how is this relevant to me? It's relevant to everybody.
Yes, because you're talking about patients, and patients are neurodivergent.
Exactly. So that needs to be sort of embedded in everybody's practice. Mm-hmm. We talked about this, in fact, it's good. You suggested this, I've written this down in my notes, a neurodiversity champion in every single GP surgery. And actually, that doesn't have to be a clinician. It could be a secretary, it could be, but somebody whose job it is to think about how do we make the care for people better in the practice, which might be making a quiet corner of the waiting room that people can go and sit in.
Yes, thinking about the lighting, that kind of thing.
Yeah, can we block off the first slot of the day for people, or the last, probably not the first slot of the day, thinking about my son, he'd never be up, but the last slot of the day to be an autistic friendly slot, so that you can come in at the end when there aren't loads of other people in the waiting room.
Yes, okay.
Be seen. Double appointments for, those sorts of things. I think integrated assessment pathways. If we are going to continue to have assessments.
Oh, yes.
So an integrated assessment pathway that actually is a neurodivergent assessment, where we could look at the child.
Look at all of the facets of it.
Yeah,
and yes,
exactly.
Yes. When money's not an object, that would be wonderful. Just have a big team of people.
And post-diagnostic support.
Oh, my God. Where do I sign up for that? That's amazing. Yes.
Yeah.
Yes. Once they're diagnosed, that's it, really, at this point.
Yeah.
It's like, right, good luck.
Yeah. And for things like, so there are a lot of things that aren't commissioned at all. So there are very few services, for instance, for ARFID in the country.
Yes.
So
Yeah.
Avoidant restrictive food intake disorder. Very few services that will see anyone with potential ARFID across the system. So those sorts of services I think we will need. So I think we need better resource specialist teams. So things like CAMHS, community paediatrics, eating disorders teams need to be better resourced. I think we need more research. I'm an academic as well as part of my job, so I do research, not in this area, but I think we need more evidence from research about what works. So what interventions work to support families and young people
Yes.
with neurodivergence. So what therapeutic interventions, what support packages actually help. And then we can actually put those in place.
But then if things are more holistic, if you're looking at their entire neurotype and every potential co-occurring condition, then you would have a better insight into what works for that specific makeup of neurotype, because it's
exactly
so dependent on what their profile is.
Individual, indeed, exactly. But at the moment, we've got very little evidence. I mean, thankfully, we're not like the States. We're not pushing behavioural approaches.
We've got ABA and things like that. Yes.
Yeah, ABA and stuff like that. We don't have really in this country, thank goodness.
Beat it out of them.
You know, what... Exactly, yeah. And then, you know, actual funding. We'd have more GPs, obviously, because we're really short on GPs. We'd have more GPs so that we can have proper shared care for things like ADHD.
Yes, just money. It's all the money.
Yeah,
that would be a really good start. And in a utopian ideal, that would be amazing.
But some of these things I think you can do without money. So integrated assessment pathways, I think, could happen. That money just needs shifting, doesn't it? It's a redesign of service rather than...
Yes, but just the capacity to do that is diminished, right? I know it does take, it will take some degree of money. But the other thing is, I guess, an understanding that by doing this and by implementing these changes, fundamentally, you're going to save money elsewhere on much more serious issues because of the unmet needs of our neurodivergent hordes, for want of a better expression. You know, all of the people that are late diagnosed, that have been misdiagnosed and mistreated and had to experience really poor mental health provision.
I was going to say, it's the mental health that I see most, and that's where I most come across this with adults. And I often say to them, you've had this long history of, you know, anxiety or agoraphobia, or do you think you might be neurodivergent? Because that really seems to me to underpin a lot of those people with chronic, you know, mental health problems.
Yes. I mean, that's the other thing that I would suggest, which I think someone else has suggested. If a child is diagnosed autistic, automatically look at the parents. You know, while you're here, you might as well fill out the same form. Just, you know, no judgment, so just getting an understanding. We're going to assess the entire family.
Yeah, brilliant.
Well, you know, we can hope, can't we?
It's not all rubbish.
Okay, so we'll look at the positives now, because it isn't all doom and gloom. Obviously, you know, the system, I think we have identified, is broken, but there are some little green shoots of optimism. I think the Oliver McGowan training that we discussed earlier came from tragedy, but has become a really positive thing that people are engaging with, as I understand it, which is great. Also, I think that there are, as we discussed, there are some phenomenal people within the healthcare system that they're not doing it for money, that's for sure. You know, they're doing it for the desire to help people, and they are going above and beyond to bridge the gaps that exist in this healthcare system, because the healthcare system is broken, and they are people kind of just filling in the gaps and doing whatever they can to try and stop it crumbling. And like, a massive thank you to everybody in that system, yourself included, who are just doing what you can to help us parents of neurodivergent kids to the best of your ability and to the best of your resources. Another positive, obviously, is the NHS. I know it's flawed, but it is a wonderful institution, and it's envied around the world. Just speak to most Americans who get it, who will see that, and you see how much they're having to pay for the care. You know, have to pay for their medical care, and you'll see that the NHS is treated with this curious bewilderment. Like, you can just walk in and get help and not have to pay for it. It's like, yes, we can. And yes, we might moan about it, because it's not perfect, but if someone criticizes it or tries to diminish it, we will be fiercely protective of that, which is quite like how I feel about my own kids, basically. I can moan about them, but if anyone else does, fuck them. I think there are some definite positives there. Have you got any positives you wanted to kind of shine a light on here, Lucy?
Yeah, I mean, I guess it's not really part of the healthcare system, but we've sort of offshoots of the healthcare system now. We've got things like social prescribing that can be really good as well. So often you'll be referred to a social prescriber who can help connect you to community organisations. And I've referred an autistic young man to the social prescriber. He wanted some work, but it was very difficult for him to get him to work. The social prescriber supported him with that. So I think that's really helpful. The other thing I would say, again, sits outside the healthcare system, but, peer support is really important. So I think, really some amazing community groups.
Yeah,
I would definitely encourage
find
people.
your people. As you say, you found your
Find your
little
people.
community, very specifically mums in healthcare with PDA kids. It's very niche, but the more niche you go, the more support you can get, because these are people that see you and understand you, and that's really important.
Shout out to the medic mums and PDA kids WhatsApp group.
Love it.
Neurodiversity Champions.
Okay, Neurodiversity Champions. Now, these are the people and organisations that are doing wonderful things in the world of neurodiversity. Have you got any neurodiversity champions that you want to shout out to?
I do. So Murmuration Community, these two fantastic women, Poppy and Naomi, who founded Murmuration Community. And I went on to very early on in our journey when things were falling apart and I was off work and it was all bad. I don't know how I found out about it, actually, but I found out that they were running nurture groups. So these are groups where parents of SEND children can come together in a space, a weekly group where you come together with the same group of people. And it's sort of facilitated. We talked about our feelings and what was difficult, and it might sound difficult, but there were tears and there was laughter and it was a safe space. And I'm now in another WhatsApp group with those women who I was in the group with, and we constantly text each other like, "You're never going to fucking believe what's happening now."
It's
and,
like, I will believe it, but go on.
I will believe it, yeah.
Lovely.
They run like retreats for parents, not like you can't go away for a week or anything. It's like a half day, but it's a space,
just
for
a
parents
space,
who are
and
struggling.
that's so important, isn't it? It's just having that space with like-minded people who understand it and get it. Yeah, massive shout out to those. I'll put those in the show notes. You got any others that you want to mention?
Yeah, so there's another charity locally in Bristol called Incredible Kids, which also supports children and families with special needs kids, and they provide lots of support. They provide play sessions for kids. They support with like EHCP stuff and those sorts of things. So they've also been brilliant.
Great. Okay, I'll give those a shout out. I'll put those in the show notes as well. I love hearing about what's happening in other parts of the world, because obviously I know what's going on for me, and so I really like hearing about all these little grassroots neurodiversity champions that pop up and how many things are active around the country. So I'm going to put a request out for any Neuroshambles listeners who want to just give me a little window into what's going on near you. Just email them into me, and I'll give them a very quick shout out. It's just heartwarming to know what's going on elsewhere, and I want to give as many people a little toast as possible.
Tiny epic wins.
Okay, tiny epic wins now. These are the moments that for neurotypical families wouldn't be a major deal, but for our neuroshambolic households, they are epic wins, and I always love these. Have you got any tiny epic wins for me, Lucy?
Well, obviously it was Halloween, and we didn't have any tears on Halloween, which is
God,
almost unheard of.
That
we
is
managed
great.
Trick-or-treating without any meltdown.
You went trick-or-treating in costume?
In costume, in a Spinosaurus costume that we'd made.
This
partly.
sounds amazing.
Yeah, and no tears or meltdowns. Last year was bad. We had lots of tears, big meltdown, threatening of a rock being thrown at me last year. Things got that bad.
Okay.
The dysregulation was real last year. This year we had two friends over for a little party in the afternoon. No tears. We went out trick-or-treating. No tears. I don't know what that is all about.
That sounds amazing. That is an epic win. Yeah. I think all of your tears ended up in my house.
Oh, shit. Sorry.
Because, no, it's fine. I'm not diminishing yours. Take the win. But yeah, Halloween was an absolute shit show for us this year. Which is, normally they love it, but I think we just swapped over for whatever reason. I'm hoping that our next year is like you're
You're
this
back
year.
you're back to normal.
Yeah, back on
It's a
form.
lot of it's a real, it's the same as, all the holidays are a nightmare, aren't they?
Yeah.
Too much.
But I'll celebrate that win. I got a tiny epic win in that India went on a school trip recently and actually enjoyed it. Now, I speak to you today because during the day, Otto is currently off school because he can't handle a school trip. It is not an easy thing for my kids. And so it was like, let's just reduce all the overwhelm and the dysregulation. You do not have to go to the opera, Otto. That's what they're doing. Like, lovely idea. Just not for my kids. Well, the flip side of this is that India did go on a school trip to Brighton Museum to see an Egypt exhibition, and she actually told me about it afterwards. She shared information, which is unheard of, because whenever Jay and Otto went, I would hear nothing. It was just like, So the fact that she came back, she told me some facts about Tutankhamun and what happened. It was just so gloriously different from anything that I experienced with the boys.
Well done, India.
It was really lovely. Thanks, India. You legend. She did complain about the fact they made her use hand sanitizer and it made her lunch taste disgusting. But apart from that,
outrageous.
it was a good day all round. So I'll take it.
What the flip?
Okay, what the flip moments now. These are the moments where our neurodivergent children will say or do anything that completely confounds and very often dispirits us. Have you had any what the flip moments in your household, Lucy?
I mean, much like yours, I think it's daily. I spent a long time, again, this is pre-burnout, pre-diagnosis. I used to document what the first words my son said to me in the morning was.
Oh, really?
I've got a little note on my phone called morning music because they're just so funny. And they're never morning, no, it's never good.
No, of course not. No.
I'm an iguana. It's a type of little lizard that swims in water, but I'm just a learner because I'm a little baby one. I'm your baby pet. This is literally the very adorable. First words that come out.
So you walk into his room and then this just comes out. Like he's been waiting to tell you. Finally,
exactly.
I can get this off my chest. I love it.
Did you know you can milk cows in Minecraft? That was...
That's so lovely. He's just been waiting to share this for you.
But actually recently he said, having ADHD means my days are like heaven or hell. There's nothing in between. Although I have had a few middling days recently.
It's interesting when they start to become sort of older and they can articulate themselves a little bit more, isn't it? And there's, but it's just a shame that you're missing out on those little lizard days again.
I know.
I once woke up Jay. I went, "Good morning, Jay," and he went, "Good morning, Hellspawn." I was like, "Oh, okay, I'll close the door. I'll let you get up in your own time."
Yeah, we got a lot of that.
I've got some what the flip moments. I got one that Jay said to India. I just overheard from a different room. He just turned her away. "India, you have the cultural awareness of a potato."
Sick burn.
Like slam. Yes, sick burn indeed. And this is like, okay. And another one I had was a discussion that I had with India, where we were talking about something. I was talking about going out and getting something from the shop. And I went, "Let's kill two birds with one stone," which I know now that India takes things very literally. So her response was, "I say kill two humans with one knife." I don't like birds being killed with rocks. I prefer animals to humans. I was like, okay, fair enough. I just won't use that again. Yeah, okay. But let's not kill humans either. Let's just not kill anything.
No.
Let's just get two things done at the same time, yeah? Call it quits. Fine. Okay, that's it for this episode of Neuroshambles. Firstly, Lucy, a massive thank you for emailing me in this suggestion because it's been a really interesting chat, certainly for me, hopefully for the listeners as well. So thank you for spending time talking about your experiences and lifting the lid on the healthcare system because there's a lot there. There's a lot there.
You're very welcome. Thanks for having me.
And thank you also to Neuroshambles listeners for continuing to download and comment on the socials and send me lovely emails and comments and reviews. You know, if you want to leave a review, that's also very welcome. That helps to raise its profile in the algorithms. So please do that if you haven't already. If you want to follow us on the socials, you can get me on Facebook or Instagram or TikTok. So find me over there and say hello. Other than that, I think all that remains for me to say is have a nice life.